welcome once again to Stay Alive with Church Alive. And this is your host and president of Church Alive Development Corporation, yes, and the proud pastor of Church Alive Community Church. And once again, we're here to bring you a holistic approach to the gospel, because God is concerned about not only the spiritual part of man, but he's also concerned about the physical. And that's what we're all about. And over the years, we have brought you quality information, resources, and services that have truly improved your lifestyle. And this program is geared once again to make improvements. This program we're dealing with is 62. And you might even know what 62 means. But out of the 62 districts here in the state of New York, the Bronx is the most undernourished in every aspect: medical care and housing and counseling, on and on. But we are here today to make a difference. We're here today to bring you the information you need to partner with us to change 62 and begin to realize that all things are possible with God. And that's the way we approach 62. And to do that, we are blessed to have some very important people that have been vanguarding the changes of the Bronx for now over 25 years. And they're here today with us. And I'm going to share with you just a little bit. And they will then speak individually in different areas of how we're going to change 62 and make the Bronx more healthy. And so we'd like to introduce our guests first, and then we're going to go right into this very important topic: making the Bronx more healthier. And to do that, we are blessed to have Charmaine Ruddock. Charmaine Ruddock is the project director, Bronx Health Reach, the Institute of Family Health. Welcome to Church Alive.
Thank you, Bishop Birkett. Thank you for having us to discuss this important topic.
Thank you so much. And then we have Pastor Wendy Kelly Carter, Beulah Baptist Church.
Good afternoon, and thank you again for having us.
Good. And then we have Pastor David Powers. That's the Church of St. Helena, Roman Catholic Church here in the Bronx. God bless you, my brother.
Thank you very much. It is a delight and pleasure to be here joining you. And
then we have Sandra Jenkins, Church of God, Prophecy in the Bronx. Welcome.
Thank you, Dr. Birkett. Thank you so much for having us today.
You're welcome. All right, now we are going to ask Charmaine Ruddock, to project director, to tell us exactly what are these disparities and how can we approach them, and how Bronx Health Reach is moving towards changing 62. Go right ahead.
Thank you, Bishop Birkett. Let me first introduce who Bronx Health Reach is and this work that we're doing to address the fact that the Bronx has been consistently ranked for more than a decade now as being the county out of the 62 counties in New York State with the poorest health outcome. So Bronx Health Reach is a 25-year-old community coalition that's led by the Institute for Family Health. There are more than 80 organizational members involved, including advocacy groups, healthcare providers, schools, community and faith-based organizations, small businesses, and some of our city agencies. We have been focused in the 25 years of our existence on really having the community drive this effort. It's a community-based, community-driven effort with the singular focus of eliminating racial and ethnic health disparities in the Bronx. And we've been doing this a number of ways. We've been implementing strategies that are evidence-based, but also very much community-informed. Our more recent focus has been on improving nutrition opportunities for physical activity, and since COVID, increasing the rate of COVID-19 vaccinations and flu. But we understand that change, the kind of sustainable, long-lasting change in the health outcomes of the people in the Bronx, will come about only if we promote the kind of policy and system changes that will effectively lead to community transformation. Our Not 62 work is part of that effort. Our long-standing Health Disparity Workgroup has been engaged in a grassroots effort starting in 2014 to widely inform the community about the fact that the Bronx is ranked 62 out of 62 in health outcomes and the factors that contribute to those outcomes. The work group also has charged itself to relentlessly advocate with those in power, those who have the ability to change the kind of systems and put in place the kind of policies that would lead to this improved outcome. So we've been advocating for them, the governor, the mayor, the borough president, our federal elected officials, to prioritize the unhealthiest New York County, which is home to to America's poorest congressional district. So as a result of that, Bronx Health Reach, along with the borough president's office, Montefiore Health System, and the Bronx office of New York City Department of Health, co-founded hashtag Not62, the campaign for a healthy Bronx. And then I'm gonna let one of my colleagues sort of dig deeper into what the Robert Wood Johnson County Health Rankings report has revealed about our poor health outcomes.
Go right ahead.
Sandra.
Yes, thank you. Yes, thank you, Charmaine. For the 2024 report, the data shows that there are places where the Bronx has improved. Our physical inactivity in the Bronx has decreased. The percent of those that are uninsured has also decreased. Unemployment had a massive improvement from 13.6% in 2023 data to 7.8% in the 2024 data. However, there are many things to improve. For 15 years in a row, the Bronx has been, as you have stated, ranked last in New York state counties in health outcomes and health factors. In the 2024 data, however, Robert Wood Johnson Foundation discontinued ranking the counties, instead presenting each county in relationship or relative to its state and to the country. So there are many areas where the Bronx health outcomes have also declined in recent data. The number of people that are reporting that they are in poor or fair health has increased. Unfortunately, adult obesity also increased from 32% to 35%. And sadly, children in poverty increased to 35%, where it had been 34%.
We have looking at disparities, and I would like to hear from Reverend Wendy Kelly Carter.
The campaign is a three-step effort. First, it's a grassroots initiative communicating to the community the fact that the Bronx is the unhealthiest county in the entire New York State. Number two, this is done through town halls, public rallies, social media, and digital campaigns, creating a set of asks targeting health, housing, and economic development. And number three, encouraging policymakers, elected officials, and community leaders to support implementing the asks through public budget allocations and through policies at the city, state, and federal levels. So as mentioned, we have a set of policy asks focused on health, housing, and economic development. Instead of telling you all of them, we would like to highlight one from each category. Thank you.
Well, the areas of disparities go into some particular areas that you would least to think that it would come up. And we're going to ask our Reverend Powers to deal with it in the area of housing?
All right. Now, we know that the Bronx has population, interestingly enough, has declined. We have, on the one hand, some of the most affordable housing. And on the other hand, according to the report, 38% of Bronx are experiencing severe housing problems. It could be because of overcrowding. It could be because of the high cost of housing. It could be lack of kitchen or plumbing facilities. As a matter of fact, Governor Hochul, in her State of the State address, she has identified as being lack of affordable housing. As a result, people are leaving the Bronx. In the past 3 years, we've had 120,000 people who have left. Now, we have increased, on the one hand, 25%, the number of affordable housing units, and there are 558,000 housing units in the Bronx, and we've increased by 25% some of them. We have designated at least 20% of funds for SCRI, for grassroots awareness, and for other public awareness campaigns in order to promote the utilization of SCRIE by seniors. We mandate new housing be set aside for no less than 20% of the families living in shelter. And we want to ensure that Section 8 guidelines, EPA regulations, and New York State health codes be monitored and enforced with penalties in existing public housing units, NYCHA, section and city managed buildings, and all other publicly subsidized housing. We want people to come to the Bronx. We want people to be able to afford to live in the Bronx. We want to make sure that the people who are here are living better. And I think we have some solid ways of helping to accomplish that.
I want to thank you so much for that, because this is the Bronx is really, to me, an oasis. It's really a mixture of people and cultures and foods and nationalities. It is really a very special place to live in the Bronx, and I'm glad you have that sentiment. I would like to go back to Charmaine Ruddock, and we're dealing with the economic development.
Thank you, Bishop Birkett. So one of the fascinating things about the Robert Wood Johnson report is that it looks at 4 categories to determine how well the people in a county are doing. Clinical care, health behaviors, environment, socioeconomic determinants of health. What's interesting is that the Robert Wood Johnson and the researchers do not equate each of them at the same level. Socioeconomic is actually considered the most significant, and that is in keeping with what the World Health Organization, many health experts have been identifying over the last 2 decades or so, that socioeconomic factors and aspects are what are critical to a person's health, to a community's health, to a county's health. And so with that in mind, the Bronx Health Reach Coalition and its Health Disparity Workgroup identified economic development areas. So technology, workforce development, and financial structure. And so for the technology, we are emphasizing that our technologically deficient neighborhoods should have 100% internet access that's both affordable and adoptable. That 100% of the public junior high and high schools serving the poor communities in the Bronx should have STEM, which is science, technology, engineering, and mathematics curriculum, with the necessary equipment, trained and certified teachers, and the maintenance resources. We have included the development of a technology center in the Bronx. We have heard of technology sectors in Manhattan, in Brooklyn. We need to have one in the Bronx as well. In terms of workforce development, we are advocating that by 2032, 50% of the workforce development program should include training for jobs in technology, including green technology jobs, and that 20% of new jobs coming into the Bronx must be set aside for Bronx residents. And then we've also included a financial component to the economic development, where we propose that 25% of corporate sales derived in the Bronx from any corporation receiving state, city, local, or other public considerations should be reinvested in high-need communities in the Bronx. That there be investment in the development and licensing of Bronx homegrown businesses owned by people of color and women, with particular attention being paid to address the deficit of Black and Latino-owned businesses in the community. And we also understand and therefore advocate that there be easier access to capital through grants, no interest loans, etc., beefing up the kind of bank regulations, penalties for disinvestments, increased transparency and visibility in how, where, and to whom public funds are going. So those are the three main arms of our economic ask. Bishop Birkett.
Now, okay, how is the Health Disparities Workgroup creating an awareness? And I believe you have a 3-step program that we need to look into at this time. And I would like to hear that from Reverend Wendy Kelly Carter.
Yes, Bishop Birkett. Many of us are directly involved in several initiatives to improve healthy eating, making our streets safer for people to get out and walk, promoting farmers markets, and leveraging our community connections to spread the word about the hashtag Not62. It is this work that many of us are doing while we saw the significant improvements in health behaviors in 2015 to 2021 reports. Bronx Health Reach have made congressional visits with staffers of Bronx congressional members, such as Congressman Richie Torres and Congressman Jamal Bowman and Congresswoman Alexandria Ocasio-Cortez, and along with Senator Chuck Schumer. At these visits, Bronx Health Reach advocated for the hashtag Not62 campaign and shared the ask. The Health Development Workgroup members have also met with Mayor de Blasio when he was in office, and in a meeting last year with Bronx Borough President Vanessa L. Gibson. We shared data from the 2023 Robert Wood Johnson Foundation County Health Rankings report and updated her on the ask. In seeking to revise our acts, we invited experts to speak on the Health Disparity Workgroup on different elements of the ask. These include faculty from Fordham University specializing in economic development and movement building. Other experts shared insights on housing and community development. As an active member of the hashtag Not62 committee, we have expanded the membership to include more key community-based organizations and develop our next 5-year action plan. And that's what we're in the process of doing. Thank you so much.
Well, there is also a 3-step plan. We're just not saying, this is it and all the information we're giving you, but we have to activate our community. Tell us about those 3 steps. I addressed that question to Reverend Wendy Kelly Carter again. And maybe you're going to go over that, but we know we can do it through the grassroots. I know we can do it through town halls. And I know we certainly can do it through the social media. Would you like to say something about that?
And we also have the town halls, as you stated, the public rally, the social media, and the digital campaign. And as I stated before, in creating the set of policy of the ask, encouraging policymakers, and the health, housing, and economic development.
Very good. We're going to take a break in a few moments. And then we're going to talk about activating our people to do something right away, and that is to vote. And it's extremely important that we get to our politicians and get them to realize that we elect them to make a difference. We don't just elect them to take a seat and look good and make good speeches, but we want them to be actively involved in making a change in 62. And so we're going to take a break right now. And we're going to come back and address this question to Charmaine Ruddock. We'll be right back.
Bronx Health Reach decided we would do some outreach to bodega owners. Bodegas are ubiquitous in the Bronx.
With Bronx Health Reach, we have tried to educate the store owners to offer more healthy options. We have created a comprehensive training program. We teach them how to sell more healthy option, how to make a profit of selling healthy option, how to run their business better in order for them to continue to grow in the market and to understand also how their communities are changing.
We try to help them to change the habit of eat something more healthy, like fresh vegetables, fruit, the water.
A huge part of getting people to eat healthier is doing the education, but also making it accessible for them.
We believe that by having access to healthy food, they can have a better life.
At this time, I'd like to go back to Charmaine Ruddock and with some important information. Charmaine Ruddock.
Thank you, Bishop Birkett. So, Bishop Birkett, as you had said right before we took the break, as we get activated more and more, particularly in 2024, it is critical that as part of our activism, we lift up the importance of voting. In both the 2023 and 2024 Robert Wood Johnson report, they called out civic engagement, the importance of voting, connecting it to what has been recently likened to the political determinants of health. And so I want to just, we cannot overstate how important it is to voting, particularly for those of us in the Bronx. In 2021, it is concerning to note that during the mayoral race, the voter turnout in the Bronx was only 15%. In 2022, we had a very slow voting start for us. And during election day, the turnout throughout the Bronx mostly hovered around 15 to 20%. Voting is critical. Bronx Health Reach has been involved in a voter registration, voter turnout drive as part of our effort around Not 62, because we understand the critical connection between folks voting and getting the kind of resources needed and the attention of those who get put into power, who get elected to making this important. So get out, register to vote. For those who are registered to vote, go out and vote. Primary elections are coming up in a few months, June 25th. Election day is November 5th. It is important for us to note that residents, when they vote, can and should impose demands on those they have elected. And then I want to turn it over to my colleague, Father David, to talk about some of the other things that Bronx Health Reach will be engaged in to activate this needed concern in the community around Not 62. Father David?
Well, one of the first things is that we have designated April as hashtag Not 62 month. We have prepared information sheets for the community and faith-based organizations. Faith-based organizations are extremely important. We have a lot of people that come to the churches, and we can be a central source of disseminating information. As a result, we have prepared sheets that can be distributed to them. We're encouraging all churches to use their platform and to share information about the hashtag Not 62 during their Sunday or their days of worship within their community. Everyone should share information about hashtag Not 62 with family, friends, neighbors, fellow congregation members, and workers. Ask your pastor in order to inform your congregation about this important issue. We've got the resources. All you have to do is contact us. We'll send you the information sheets. You can give it to the pastors, and the pastors can share it on the pulpit. They can share it in newsletters with the community, and this will get out to tens of thousands of people. Sign the Not 62 petition to demand that elected officials prioritize the health of the Bronx. And this petition can be found on the Bronx Health Reach webpage, which is https://institute.org/not62/. And finally, call your elected officials. Ask what they're going to do to improve our last place standing in health. The Robert Wood Johnson had health rankings. And now let me turn it over to Sandra Johnson to tell you a little bit about some of those health issues.
Thank you, Father David. One of our health policy concerns that we are advocating for, there are many, but I'm going to cut it down to the most prominent, to increase funding and resources for professional, faith-based, and community-based mental health care. We feel like mental health is a very big need in the Bronx. To expand our New York City care to nonprofit and federally funded neighborhood health centers, in addition to the current New York City Health and Hospitals Corp. We also want to enact accountability requirements and enforce with penalty measurable community provisions of the Jerome Avenue Neighborhood Health Plan recommendations. And we want passage of the New York Health Act, which the City Council unanimously approved back in December of 2018. It's before our state legislature now, and we ask you to please speak to your representatives about the New York Health Act. Thank you so much.
I want to thank all of my guests, done a fantastic job of communicating, and I trust that our viewing audience will respond. It's imperative, especially those in the Bronx. And I want to say quickly to those who are not in the Bronx, that if we don't deal with the issues of the Bronx, the problems of the Bronx will be your borough as well. And so we want to thank everyone, and I want you to remember, together we can create a healthier Bronx. God bless you. Until next time, we love you with the love of the Lord.
In 99, 2000, we were focused on diabetes and heart disease, but now we look at all of the issues that impact the community's health. I just see us continuing to grow and continuing to work.
The funding that will come in after people like me have left will mean that where the new people start is not where we started, because we have moved the ball down the line.